Hello and welcome to South Dakota Project Firstline's April office hours. April's office hours are going to look a little different. I'm doing a recording. And during this recording, I am going to navigate you through the website and show you where to find the resources and tools that we often reference. My name is Rebecca Syme. I'm a registered nurse. You're probably familiar with me with past office hours. My partner, Jessica Danko, uh, and I are South Dakota Project Firstline. As you can see here, we get started right away. This is the homepage of the South Dakota Project Firstline.org. As you may be familiar, Project Firstline was created in the wake of COVID to help get infection prevention training and education to frontline healthcare workers. Since then, it has evolved to include all areas of healthcare and to really bring infection prevention training and education to everyone in healthcare. Jess and I work for the South Dakota Foundation for Medical Care. So I'm going to take a quick moment here to pop over to the South Dakota Foundation for Medical Care website. As you'll see up here in the top left, sdfmc.org. I will admit that this is my second recording, and hopefully when you hear this, you don't hear me say recording 3 or 4. I'm going to stumble probably. If by all means I don't quote something exact, well, I'm going to do my best today and try to share some good stuff with you in the process. So the South Dakota Foundation for Medical Care offers a ton of resources for you too. We talk about the CDC's resources, but some of you may work in the long-term care setting, some in a hospital, maybe a surgical center. We're now doing congregate living situations. So reaching out to those people who maybe work in an assisted living or other group home, as well as we do infection prevention training and education for EMS providers in the state of South Dakota. Part of the creation of Project Firstline by the CDC was to reach out to each state individually and have them assess their needs. And one of the needs for South Dakota, with us being a rural state, was our EMS providers, our emergency medical service providers. We are rural, so a lot of the people are volunteers, and they were really lacking that infection prevention in their settings. So that was identified as one of our needs areas, and we continue to try to address that and so many more. I'm going to just briefly here go over the foundation's website. You can see the staff here. We have lots of programs that we're working on, and these individuals are involved in great things from long-term care to, I mean, a ton of stuff. So as you can see, there's my cohort, Jess. And Sherry, who does HAI work, which we have featured on our South Dakota Project Firstline office hours, as well as Sherry was a pioneer for us here at South Dakota Project Firstline. You might recognize Lori if you're from the long-term care setting from GP Quinn. We have the CHW program, the Bright Starts, just a ton of stuff. I would encourage you to pop over. There is myself to the foundation's website and see what other resources and links we have here and things that we're working on that you can utilize for your setting. So in the news, South Dakota Project Firstline is really doing so many things. You may see us in office hours and maybe not anywhere else. We really are up to a lot of different things, and I wanted to show you this page to kind of show you some of that. So measles is a hot topic right now. Here is an article that we have created at the foundation, and it covers the high alert measles warning for clinicians. This is a CDC based product information that we have shared here. Unfortunately, I'm recording this for April ahead of time, and this will reach you after this measles update and webinar. But we do have a link to the new measles stuff on the South Dakota Project Firstline site, which we'll see in a little bit. And hopefully you were able to connect with this and are watching and being in on that measles webinar. So let's see. We'll go back Another thing here, we recently did a collaboration with Compass, KFMC Health Improvement Partners, and South Dakota Project Firstline worked together on a series that I think would fall right in line with what we're doing here today, which is a Train the Trainer series. As you can see, it's part 3. You can follow this link. And if you have any questions or need any additional resources or need help getting to the past sessions of this, it's kind of like what we're going to do today, which is to navigate through some of the resources and really help show you what's out there and available for you to use. And how to make use of that. So reach out if you can't make this connection and you really want to see some additional Train the Trainer stuff. There's really good stuff in there. So the HAI program that Sherry works for, as well as South Dakota Project Firstline, recently worked on cleaning week. So Governor Kristi Noem issued a proclamation for the state of South Dakota for March 24th through the 30th to be National Cleaning Week. This falls in line, obviously, nationally, and a little extra above and beyond for the state of South Dakota. So you see when I highlight on it, or when I hover over it, it highlights it. You can click that and follow that there. Here, as you can see, this is our March office hours. So just telling you, we featured the microlearn for diarrhea. I talked a little bit about how South Dakota Project Firstline works with emergency medical services. We go out to EMS facilities. We can do that either virtually or in person, do training sessions and provide infection prevention training and education. So if you're watching this and you maybe very well might be an EMS volunteer in your local community, know that we have some resources out there for you too. So check that out. Here is an article we wrote for Med Magazine. We submit an article to Med Magazine. Med Magazine features a ton of great things too. Another resource for you to check out. Prairie Lakes happens to be what this article was about. And part of Prairie Lakes was South Dakota Project Firstline had the opportunity to complete some training and education for Prairie Lakes. Prairie Lakes then took the recording that we provided for them afterwards and they plugged that into their learning system. You can do that too. They also utilize, and you can as well, downloading the posters, putting those in emails that you send out. Just a great article that kind of talks about some direct quotes from their employees there of utilizing the material. Again, the Train the Trainer session, that's for the second session. And again, a plug to office hours. So with that, if you're at the South Dakota Foundation for Medical Care's website, right here on the top, you can click the tab that would take you over to Project Firstline. And I'll do that now. I have the window open just to make my screen a little less busy for you. So here we are again back at the South Dakota Project Firstline homepage. As you can see here, it gives a little intro that it's a CDC-led training collaboration with the Department of Health and the CDC, and Jess and myself from the foundation, we bring you South Dakota Project Firstline. If you click on the Learn More tab here, as you can see, we were on the home page here, and it just transitioned us over to the About page. It'll talk about our mission, our goal, a little plug here for some national recognition, which we will go back to later. As you can see, myself, Jess, and Sherry. And I'll scroll a little bit further, and this cute little face here is Elise. Elise, if you see items on our socials and a lot of the brochures and individual things that the foundation and South Dakota Project Firstline puts out, Elise and Stacy also in communications are responsible for that. They do a ton of work for us and we are very grateful for them. So now that I have talked a little bit about socials, we're going to kind of skip around today. It'll just going to be the nature of what happens. I'm probably going to fumble for sure. So bear with me. The socials are located here on the website. If you click these, it will take you to South Dakota Project Firstline on each one of these social platforms. So you can keep up with us there and what we're doing, interact, that kind of stuff. I'm going to toggle back over to the home page. And now we're going to do the visit the CDC site here. So if you click this, this takes you directly to the Center for Disease Control and Prevention, and specifically to Project Firstline on the CDC's website. There is a ton of information here. And I think you could go on and on and on and on navigating this. I'm really going to stick to the South Dakota Project Firstline's website and where to find things on that, just because it's a smaller window and a smaller space too for navigation. Just know that the CDC has a Project Firstline website and there is a ton of stuff on there. If you can see, there's an announcements, these things change, some featured resources. Right now, we've been showing you the microlearns most recently. They are continuing to release new microlearns. So if you check back periodically, and again, we will feature them on the South Dakota Project Firstline website too, as well as in some trainings and let you know that those things have been released. But if you're here and you're on the tab, know that you can find new products that have been released here. I said earlier, a national recognition. Here is that little piece. South Dakota Project Firstline was a featured partner, and this is, again, right on the CDC's website right now for the scavenger hunt that was created to promote training and educational resources. The scavenger hunt, we're going to cover a little bit on our website later, but that was a great fun tool for use in whatever you may see fit for that. I think about upcoming for us, we are going to the HOSA conference, which is a state leadership conference for high school students and those thinking that maybe someday they want to pursue a career in healthcare, and it helps introduce them to areas of healthcare. So we are attending the HOSA conference and we are going to do the scavenger hunt. So what we'll do is we'll post the posters. And again, we're going to get into this a little bit more later. We'll post the posters and they will be able to complete the scavenger hunt and interact and have some fun with that. Oftentimes, fun and infection prevention training and education aren't usually in the same sentence, but at South Dakota Project Firstline, we really try to think about ways to be interactive and, if at all possible, introduce some fun stuff. And this is an example. I'm going to click on that link on the CDC's site here, and you can see the feature. Gives a little bit of an article. You can read that. Go ahead and click on. Again, I only have 30 minutes with you here today, so I am not going to spend a lot of time there. I'm going to navigate back to the CDC's homepage for just a minute here and show you infection control. So you can click on each one of these educational materials. This is a big one where a lot of the stuff that's on the South Dakota Project Firstline website is also linked here. So the training toolkits, the interactive resources, print materials, the posters, things like that. So I'm not going to spend too much time here just because I really want to show you the Project Firstline's website and where to find those things. Again, a little more contained and a little easier to do. So if you were to be at a conference, and now that we're back to the home page and the post-training survey, at a conference or a virtual or a live training, you will see us pop that QR code up at the end. This is the question form that comes with that QR code. We do report to the CDC, so this is a tracking tool for us and for them. It has 6 really simple, easy questions on here. Did we increase your knowledge? Would you recommend the training? 6 quick little questions, and then hit the submit button here. So that you might be familiar with also at the end of office hours. So in lieu of, again, I only have so much time, I'm going to keep moving here. We're going to navigate to the training. These trainings exist. You can just simply follow along. Again, Project Firstline was created in the onset of COVID. So these modules were from the beginning. As you can see, we clicked on module 1. These trainings exist. They're already there. If you want to assign a video, you can download these. You can add them to your trainings. You can assign them in your learning process or in your interpersonal learning platforms, plug and play. So this will take you to the link. I just clicked along. You can play the episode. It will provide a great little bit of information there, and they're here for you to use. So as you can see, episode 1, what's the goal of infection control? 2, they tell you what each one of them is about. And at the end, you can assign a certificate of completion if you want your employees to report back to you. And if you're an EMS person, again, some of you might play a dual role in your life and volunteer for EMS. Continuing education credits are available through that. We have worked to develop that curriculum with the South Dakota Emergency Services Association, and that is available. If you have questions about that, you can reach out to us. We can provide more information to you for sure. So as you can see, the training videos and modules here are associated together. There are 8 of them. Um, just another resource to show you how these things are available to you, and you can just adapt them and use them in any way. So, sorry, we are going to click over to the resources tab. South Dakota Project Firstline offers a ton of the CDC's resources. And again, CDC page is huge, but we have the majority of those things here and easy for you to navigate. Monthly office hours. Today I'm recording April's session, but as you can see, March, February, they're all here, past episodes, and you may utilize this already. If not, now you know that it's here and you can watch past office hours, each featuring different things. The photos, so here we've been having Sherry also join us, and she brings a lot of great photos from what's happening in real life in the process of the HAI ICARs that we assist with and go out and do. So you can watch past office hours there. We'll go back to the resources tab, monthly newsletters. We put out a newsletter. Oh, sorry, I completely skipped that. Click to register for office hours. We have added this. If you follow that link, it will take you to this form. If you're not already on our office hours list, you can fill this out and we will get you included. So you will get the calendar invite and be able to join us during our live office hours or watch the recordings as you saw there. So skipping around here just because multitasking and talking, and you can do this many ways, and I'm going to open 27 windows, but we're going to keep moving. So newsletters, same thing. You can find all of the newsletters here from the past, as well as if you want to join and be on the newsletter list, fill out the form here, submit it. It goes into our queue, and we will get you on the newsletter subscription. The scavenger hunt, we talked about that national recognition on the CDC that's on there right now. Here's the scavenger hunt. As you can see, the instructions gives you an instruction of how it works and how to utilize it, and then to think how you want to utilize that within your facility. It includes the posters. You can click on each one of these individually and follow those links, as well as if you want the full download, you can find it here and you can easily put this to work for yourself. Great product, fun, something different to do, that's available to you there. So the Project Firstline flyer, this gives kind of an overview of South Dakota Project Firstline as a whole. Again, in an effort to continue to move forward here, we are going to go here. We talked about measles, and that is a super hot topic right now, and something we definitely need to be mindful of and have on the radar. So the CDC measles poster is here. You can click on any of these, download them. I'll show you, this is just one example of how you can do that. Click the download or the save here. Save it wherever you like. As you can see, there's the poster for you to use. Many other posters here. Um, there are posters that can help to your staff or residents at your facility. You can find posters for that, um, as well as just a bunch of resources here. You see us probably in office hours, and definitely if you've been in any presentations we've done live or virtually, reference these Where Germs Live posters. Really, statistics show that if you were to print all of these posters and hang them up in one place in your facility and leave them there for an extended period of time, that they get looked past. So really a good practice would be to take one, we're going to start with Germs Live on the Skin, and click on it. Take one of these, hit the save up here in the right-hand corner, or however you do that, many different ways to do the same thing. Download the poster and feature one. Feature one a month. Feature it in maybe your monthly meetings, or if you do a weekly huddle or a morning huddle. Really, these are quick and easy. Print it, cover it during that meeting, and then move into whatever else you have to cover in that meeting. A quick, easy way to add a reminder, add a topic. It's really just, it's endless what you can do with these things. Plug them into what you do every day and how you do it, whether you have an existing robust IP program or you're just creating one. Know that these tools have already been created for you, these resources, and utilize them. So maybe you want to print one of these posters, and the first Monday of every month you hang a new poster by your time card. It gets your staff thinking about whatever the topic is. So a great resource. All right. So this just goes back to kind of the same thing. That was our feature showing measles. We wanted to set that apart. But again, back to the posters. There are a ton there. So we went from there to the CDC posters and social medias. So here, Elise has put together social media posts that we have done. You can follow these in the socials. You can, again, download them, save them, utilize them. There are a ton, a ton, a ton. Utilize these in your own socials. Easy. The work has already been done. You just have to save it and plug it in your platform. All right. Oops, sorry. Lots of bouncing around. I'm already at 23 of my 30 minutes, so time disappears so quickly. Videos and links. Here you can see there are a ton of videos. This is easy enough, I'll show you. So if you can see my cursor here and those three little dots, if I wanted to take this video and embed it into, goodness, we've had so many good examples. If you wanted to embed this into an email and you just wanted to say, hey staff, uh, this is our feature. Watch this quick video for some additional information. Or some facilities have told us that they have a continuous feed systems, like maybe they play interfacility video in their lobby or in their waiting areas. You can save this and download it and embed that into that. Or if you utilize a learning platform, you can embed this video and assign it to staff. So these three little dots here, you just click on that and right there you can see download. So you can simply download that and plug that into your platforms. Great, great, great way to just take something that already exists in our busy lives, where we already have more work than we can do, and just plug it in. So as you can see there, there are some videos that you can access there. Interactive resources. This will include some interactions. So we are going to click here, the diarrhea dilemma. These are CDC created products. So this is going to take you to the CDC website. You can take a moment to read this here, but basically what this says is a way to get your staff thinking or yourself thinking about diarrhea and issues, infection prevention that we can have. So I'm just going to click the start button here, and it will see the diarrhea dilemma, excuse me. You go to change a patient's bed linens. When you pull back the sheets, you notice there's diarrhea on the sheets, and some may have gotten on your hand. Click the next button. It's all right here for you. So it asks you, what's the first thing you should do? Select the correct option. I'm going to say clean the mattress. I know that's not the appropriate one, but I'm just going to show you what happens in the interaction. So it will tell you incorrect, try again. Great resource. Another one here, fidgeting Felix, a similar thing. You can just click on it, walk through, assign it, put it on your overhead, and start one of your meetings with it. These are really great, we're finding, as a tool to get that icebreaker out of the way, to start that interaction with a question and answer. The what's wrong with this picture, another great tool. Healthcare workers need to be extra aware of where germs are found and how they can be spread to surfaces and people. We can help stop infections when we recognize the risk for germs to spread. In this image of an emergency department, select 3 problems that need to be fixed to reduce the spread of germs. So what it's asking you for is to look at this. You can ask staff, this is a great interaction, and just have them blurt out the answer during a meeting. And they might say, his mask. His mask is not over his nose appropriately. And you can then click that. And it will take you to this page, not wearing a mask over the mouth and nose, and give you a good explanation into that. Great tool. I'm already at 27 minutes. I'm going to run out of time. So let's click back to the resources tab here and keep going through whatever we can get through. So training toolkits. This brings you to the microlearns, which we have a separate tab for and breaks them down. But as you can see, you simply click here or the picture, and this will bring you to the microlearns that we have featuring. We can go into a little bit of depth on this, but really we did this in last month's where we navigated through this. So watch that episode too if you want a little more in depth. But here's the user guide. This doesn't provide a script per se, but it walks you through how to host this training using this microlearn and using this topic of blood. It tells you, introduce the topic, gives you some key information there, expand on it, some stuff to share, discussion points with your team, and wrap up and reinforce. So really, what this does is provides a great structure so you don't have to create something. You can simply use the guide, let it help as a basis to lead your training. The microlearns here, we just covered. You can click on them individually. We listed them for you here, blood, cough, congestion, etc. That's where they can be found. The CDC has put some of their products into Spanish. I do think that this is great, and there's so many languages out there, and we continue to try to be inclusive. So this is the CDC's way. If you need Spanish resources, know that this exists for you. All right, and we are going to navigate back to Project Firstline space. The scavenger hunt, we have a tab for it here. Media. Again, this breaks it down. This is a great way. My introduction earlier kind of told you of all the things we're doing at Project Firstline. April's a busy month. April and May, it's spring conference season. You're going to see us out and about at a lot of different conferences. Come up, ask us questions. That's what we're there for. If you need anything, that's a great time to have a conversation. As you can see here, we are doing a ton of things, cleaning week, articles, APIC chapter Jess was involved with. Check this out too. There are so many great resources here. We do a podcast spotlight, a feature that's kind of another fun thing. So check this out here under the media tab, and then contact. I am at 30 minutes, so I apologize. I'm going to wrap up. You can contact us via our emails here. Reach out to us on the homepage, contact us, join the newsletter, join the office hours. Really, we're here to help in any way that we can, and we enjoy doing that. We can do in-person training sessions, virtual training sessions, answer any questions, connect you to resources. We do our best to find the answer to anything you ask if we don't already have it. So with that, I am going to wrap up. Thank you for joining April's office hours. They're a little different. I hope that this helps you maybe get over a little bit of the hesitation you might have still with any of the products. I hope it helped show you the website and where to find things. And Jess and I are always here to help. So with that, I will leave you for today. Thank you.